Working for you tonight, the cost of medicines can be a huge burden for many Hoosier families. This summer, drug companies will start listing their prices on their TV commercials. Our Annie Taylor reports on the extreme measures that some families are taking.
We believe patients deserve a clearer picture of what they can expect to pay at the pharmacy.
Johnson & Johnson became the first drug maker to reveal the prices of its prescription medicine this year. They included the list price and potential out-of-pocket costs that patients will pay. Health advocates we spoke with say transparency is great, but that's not going to lower drug costs. Leah Greenseed is a mother to a daughter with type 1 diabetes and says prices vary all the time.
It's really hard to talk about costs, but it's one of the most critical pieces to keeping her alive.
She recalls paying $700 once for her daughter's insulin. It wasn't until a family trip to Canada where drug prices for insulin changed. The insulin she brought for her daughter wasn't working, and they needed to stop at a pharmacy to get new pens.
I then was worried about how much it was going to cost. And when he told me what it was, which was about 1/10 of the price that we were paying in the United States, I got all teared up.
In the U.S., it cost her $490 for 5 insulin pens.
And I bought the same exact 5 pens for $93 in Canada.
She knows traveling to another country to buy insulin isn't the solution, but right now, it's worth it.
In our experience traveling, the insulin that we've used abroad is exactly the same formulation as the insulin in the United States.
Leah says, forget about the commercials. Let's focus on lowering drug prices altogether. I'm Annie Taylor reporting.
In Indiana, Governor Holcomb just signed a bill establishing a legislative study committee. That committee will meet this summer and dig into the rising cost of prescription drugs for Hoosier families.